Hi everyone. In this video, we will discuss prochlorperazine. What is this drug prochlorperazine? Prochlorperazine is nowadays used as anti-emetic agent, but the suffix perazine indicates this drug belongs to phenothiazine category. Phenothiazines can be used as antipsychotics, but prochlorperazine is a old generation antipsychotic. Due to development of new generation antipsychotics, prochlorperazine is nowadays not preferred as antipsychotic. Instead, it is indicated as anti-emetic. So today in this video, we are going to see how this prochlorperazine acts, what are the important precautions, side effects, chemical nature and dosage forms. All these things we will discuss in this video. So first of all, let us see the chemical nature of this drug. So this is the structure of prochlorperazine. It is having the propyl side chain which is indicated within the prefix pro, and is having the chlorine, so chloro. Propyl chlorine perazine, that is a prochlorperazine. Now let us give the numbering to this ring system. This ring is nothing but the phenothiazine. We have to give the least number to the sulfur. So let us start the numbering. This is 1, 2, 3, 4, 5. And so on we can continue so that we will get the 10th number to the nitrogen. Now the ring is phenothiazine, which is having a chlorine group at the second position, so 2-chloro. And now at the 10th position, it is having the side chain. Let us give the numbering to the side chain. This is 1, 2, 3. So simply it is having the propyl side chain. We can write this as 10-propyl. Now to this propyl chain, piperazine ring is attached by first position. And this piperazine is having the methyl group at the para position, so we can write this as 3-4-methyl piperazine 1-allyl. That is a complete name of prochlorperazine. Now let us see how this drug acts. Even this drug acts on the different types of receptors. Its main action is observed on the dopaminergic neurons. So this is the presynaptic dopaminergic neuron, and this is the postsynaptic neuron equipped with D2 receptors. The presynaptic neurons are equipped with voltage-gated calcium channels. When calcium enters into the presynaptic neurons, it produces the exocytosis, resulting in the release of the dopamine. This dopamine can act on the D2 receptors, resulting in postsynaptic activation. Now, this postsynaptic activation sends the signals to the CTZ, which produce nausea and vomiting. So, CTZ chemoreceptor trigger zone is one of the important nuclei within the CNS, which recognize the chemical signal, thereby it induces the nausea and vomiting. Now, prochlorperazine is one of the drugs which can block these D2 receptors so that it can inhibit the postsynaptic activation, resulting in the decreased stimulation of CTZ, leading to inhibition of nausea and vomiting. That's why prochlorperazine is nowadays acting as anti-emetic agent. What are the precautions? One of the important precautions of prochlorperazine is that this drug can produce increased prolactin levels, because dopamine is going to reduce the prolactin. When this dopamine action is antagonized, it increases the prolactin levels. So generally, the raised prolactin levels are not significant in the normal patients. But when this drug is prescribed for chronic period, it can produce galactorrhea, increased lactation, and gynecomastia, enlargement of the breast, which is commonly observed with many of the antipsychotics belonging to phenothiazine category. So when this drug is indicated as anti-emetic, for a short period, these side effects may not be observed, but on chronic use, it may produce some galactorrhea and gynecomastia. Similarly, prochlorperazine is not only acting on the dopamine receptors, it acts on the different types of receptors. So this drug can block the H1 receptors, resulting in increased sedation, drowsiness and dizziness. As many of these antihistamines are sedative in nature, so prochlorperazine is an antipsychotic as well as antihistamine, so it can produce some sedation within the patients. Similarly, this drug can also block the muscarinic receptors, resulting in the anticholinergic side effects. It can produce some dry mouth, constipation, blurred vision, and even urinary retention. All these side effects are commonly observed with many of the antipsychotics producing anticholinergic action. And finally, this drug can also block the alpha-1 receptors, resulting in orthostatic hypotension. That's why this drug should be started at very low dose in order to avoid sudden orthostatic hypotension within the patients. Similarly, this drug can produce some motor side effects commonly observed as extrapyramidal side effects, EPS. So these are the group of side effects commonly observed with many of the antipsychotics which are blocking the dopaminergic neurons at nigrostriatal pathway. So prochlorperazine can produce acute dystonia, some disturbance in the tone of the muscle. This may further extend to akathisia, restlessness, which can further extend to produce Parkinson-like symptoms resulting in muscle rigidity, muscle incoordination, and finally it can lead to tardive dyskinesia, some involuntary movements within the patients. So by increase the dose and duration of the therapy, the extrapyramidal side effects may be observed with this drug. So prochlorperazine can produce neuroleptic malignant syndrome, which is commonly observed with many of the neuroleptics such as prochlorperazine. In this condition, we can observe a sudden rise in the body temperature resulting in the hyperthermia, along with some muscle rigidity, muscle spasm, and increased heart rate resulting in tachycardia and confusion. All this can be observed with acute renal failure. So if any of such symptoms are observed, then prochlorperazine should be avoided in order to eliminate neuroleptic malignant syndrome. Similarly, this drug can produce some tardive dyskinesia, which involves involuntary movements which are somewhat irreversible. So even by stopping of the dose, this dyskinesia is not completely cured. So this drug should be carefully given, and any symptoms of tardive dyskinesia are observed, then immediately this drug should be stopped. But with prochlorperazine, as it is used as antiemetic, the tardive dyskinesia is produced only after chronic use. Under normal therapeutic doses, this tardive dyskinesia is somewhat less pronounced. But in the children with any dehydration or children suffering with chickenpox, in such conditions, this dyskinesia may be promoted with use of prochlorperazine. What are the side effects? The important side effects of this drug mainly include drowsiness, dizziness, hypotension, some blurred vision, leukopenia, decreased leukocytes, and agranulocytosis. It can also produce extrapyramidal side effects such as restlessness, dystonias, pseudo-Parkinsonism, Parkinson-like effects, dyskinesia, disturbance in the kinetic movements, and contact dermatitis. When it is given by IV solution, it can produce some contact dermatitis, and even it can produce some skin rashes within the patients. How it is given? This drug is available as tablets at strength of 5 mg as well as 10 mg. It is also available as extended release capsule, which is having a coat which releases the drug in an extended way, and these capsules are available at different strengths such as 10 mg and 15 mg. It is also available as solution intended for IV or IM use at a strength of 5 mg per ml. It is also available as suppository, which is given by rectal route at a dose of 5, 10 and 25 mg. The dose of the drug depends on the type of dosage form. As a tablet, the dose of the drug is variable from 5 to 10 mg, given thrice or 4 times daily. Even the IV solution is given at a dose of 5 to 10 mg to control the nausea and vomiting. And the rectal dose of this drug is 25 mg given twice daily to control the nausea and vomiting. So that's about this drug, prochlorperazine, which is a phenothiazine type antiemetic agent. This drug blocks the dopamine receptors, thereby produce the antiemetic action by reducing the stimulation of CTJ. But this drug can also act on the other receptors which produce various side effects such as drowsiness, dizziness, sedation, orthostatic hypotension, and anticholinergic side effects. And this drug can also increase the prolactin levels, and it can stimulate the extrapyramidal side effects. Finally, it can precipitate neuroleptic malignant syndrome resulting in sudden muscle rigidity and hyperthermia. But nowadays, this drug can be used as antiemetic. Even other antiemetics such as 5-HT3 antagonists are available, but still prochlorperazine can be used as antiemetic to control nausea and vomiting. So that's about this drug, prochlorperazine. That's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.